Tell me some of the areas that you're working on in the field of infection and making a diagnosis.
Well, one of the fields that I've worked on most, I think, is the field of malaria. And we're very excited because diagnosis of malaria can now take a great leap forward. We've been working with technology companies to develop a handheld diagnostic device. So what this is it's like an iPhone, and you take a drop of blood from a patient and you put it into a little disposable cartridge that plugs into the iPhone, and in 15 minutes time a result pops up which tells you actually very sensitively if there is malaria there or not. But there's something added there which comes out which we don't have at the moment, and that is we can also see if those parasites are carrying evidence of drug resistance, mutations for drug resistance. So what you can do is you can start to think about personalizing treatment for patients right at the time that they come for diagnosis.
That sounds phenomenal. And at what stage is that development?
We're now, the company we're working with, and this technology, by the way, can apply to all sorts of infections, and we're also now thinking of Ebola virus disease, which we've been involved in vaccine development for, and now what's popped up is, of course, Zika, so we're working on that as well. But the technology readiness state, if you like, is it should be becoming commercialized in the next few months, so this year, towards the end of this year. And
just to be clear, it's the adaptation of an existing phone or a new device. You mentioned an iPhone.
Yes, it's iPhone-like, but it's a new device because what it has to do is to be able to provide power to run these very fancy reactions. What we've done, we've taken what happens in the lab, which is to separate DNA, to amplify it up, and to make lots of it, and then to detect it. We've put all that into one cartridge, which I think is a major technological advance, and that this technology can then be applied to all sorts of other questions.